Good afternoon, everybody, and thanks so much for coming along today to our webinar, which is going to be about exploring medicine today. So just some quick introductions. So my name is Fiona and I work in the widening participation team here at St George's. I have some other colleagues that are going to be helping us today. So my colleague in the background, Jenny, is going to be helping answer questions. And we also have a couple of medical students here today. If you want to come on and introduce yourselves.
Hello, I'm Billy.
Hi everyone, my name's Lima.
Cool, thanks guys. So just a couple of housekeeping bits and pieces today. So you are able to ask us questions by typing them into the question box or chat box that hopefully you can see on your device. If you do want to just type in questions today as we go, no one but the staff today will see those questions, and we'll try to answer them today or later today if we're not able to get to them. What else? I think that's probably about it. You can't, speak to us. You can't, come on camera or mic to speak to us. But as I say, you can ask questions throughout. And we'd really like to get your participation throughout today because it's going to be a lot of us talking at you. So yeah, so do please get involved when necessary. Okay. So this is what we're going to be covering today. So we're going to be finding out a little bit more about us, St George's University of London, thinking a bit about, why you want to do medicine and why you might not want to do medicine or what the challenges around medicine are. Thinking a bit about the application and admissions process for medicine. Thinking about the skills required in medicine as well. Then we're going to have a bit more time for you to meet Billy and Lima, our medical students, and find out a bit more about them. Going to have some top tips and then some time for questions at the end. Okay. Okay, so first off, just to tell you a little bit about St George's and who we are. So St George's is a very special institution, partly because we are a specialist healthcare university, so we only teach medicine, healthcare and science subjects, and we also share a site with St George's Hospital, which again makes us pretty unique. So St George's started teaching people to become doctors back in 1752, I think. And on the picture on the left here, you can see, where we started life in central London, Hyde Park. In the early 1980s, the hospital and the university moved to Tooting in southwest London. And on this slide, you can see outdoors of the university. You can also see some of our facilities, the library. Like any university, we have, facilities, student union, pathology museum, dissection room as well, all the type of standard things you'd expect with the university. You can also see here the helipad for St George's Hospital. So St George's Hospital is a huge trauma centre specialist in London, and you might have seen St George's featured on 24 Hours in A&E recently. And I think that because we have that close proximity with the hospital, we offer our healthcare students a kind of unique experience. They're studying healthcare, but they're also surrounded in that kind of hospital clinical environment from the get-go. So we like to think we offer something really special to our students. So at this point, hoping you're all here because you're thinking about medicine, and I'd really like to ask you, the audience, why you are interested in medicine. To do that, all you need to do is to open the question pane, the chat box, and type in your thoughts, okay, and tell us a bit why you want to do medicine. What I'll do is I'll have a quick look in a second as you start to type things in. I'll maybe share some. Rest assured, I'm not going to share, your full name or details or anything like that with the audience, and then we'll ask our medical students for their perspective on why they want to do medicine and why they enjoy it. Okay, so while you're doing that, I will have a quick look and see what questions people have. Okay. None have come in yet, but if you can pop them in, tell us a bit more about why you want to do medicine and what attracts you to medicine. That'd be really helpful for us to hear about. Okay, wanting to do something for the community. That's great. Wanting to work with and help people. Yeah, totally. Medicine is something where you're definitely obviously working a lot with people. Interest in biology, being favourite subject. Solving puzzles, and again, helping people. What else? Thank you so much. Loads of stuff coming in at the moment. What else? Meaningful career. The privilege position of helping people day to day. What else? So many things people are saying. Profession that's driven by science but also compassion, Debbie says. Curious about how the body works and how we can fix things that goes wrong, says Ben. Lifelong learning, that's so key for medicine. So it's definitely something that you do obviously when you're studying as a medical student, but obviously after that you still have to keep on top of what's going on. So yeah, definitely something if you want to keep learning throughout your lifetime. Ollie's saying, being inspired by other people, combining scientific knowledge with social responsibility. So yeah, that's really great. Thank you so much for your contributions there. Every day is different. Again, a really key point. If you want to be doing a career where there's lots of different pathways and where you can be doing something different every day, medicine's a really good opportunity there. Thank you so much for your contributions. It's really good to know. And obviously, given this question thought at quite an early stage is really important. Obviously, because you need to really examine your motivations, why you want to do medicine, not least because it's something that will definitely come up in the application process. So it'll be something that you want to address in your UCAS personal statement, but also you might be asked about it at interview, and it might not always come up in such an obvious way. You might not be asked, why do you want to do medicine? But you'll probably be asked around a question that involves you kind of talking a bit about your motivation and also definitely your key skills about why you would be good to do medicine. So thank you so much for contributing there. If I can ask Lima and Billy to come on and just talk a little bit about why they wanted to do medicine and also why what they enjoy about medicine at the moment. Billy, do you want to start?
Yeah, so like most of you have said, I wanted a job where I could use my skills to help people. But I also wanted a job where every day was different. I'm quite a social person and I liked the idea of all the different characters that I would get to meet every day. And what I've really noticed is that you get to see life in its entirety. So you get to see the good bits, the bad bits, and everything in between. I think that's a real privilege and unique to a job in healthcare particularly. But why specifically medicine was because I like the scientific aspect as well, so that was combined. That's my answer.
With me, similarly to many of you, I really enjoyed the sciences at school as well, but I never really wanted to go down a purely scientific route. So that's when I started thinking about medicine, and I did a bit of work experience, and once I did the work experience, I really decided that medicine is the career that I wanted to pursue. Not only because I saw science being applied, but also because of the interaction you get with patients, but also with different healthcare professionals. And I think medicine really does open a lot of doors. So there's so many things you can do. You could teach, get into academic research, all the different types of specialties, and especially recently, there's lots of different things you can do with medical technology. So yeah, it does open a lot of doors, and that's something that was quite important for me.
Great, thanks everybody. Yeah, and like I've mentioned earlier, so thinking about lots of things that people are talking about are, helping people, learning how the body works, lifelong learning. It's good to think about, particularly when you're thinking about applying for medicine, what is it actually that makes medicine different? So in terms of training to be a doctor, what are the differences between that and working in another healthcare field? Because actually, if you think about professions like being a physiotherapist, being a radiographer, and being a paramedic, those type of professions, lots of them might also involve, using science, anatomical knowledge. Every day is different, and helping people. And that's something that you might be asked at, medical school interviews. Well, why do you want to do medicine and not nursing? Or why do you want to do medicine and not, physiotherapy? So it's actually really good to kind of develop your kind of thinking from these initial starting points and think, well, actually, what is it that a doctor does that's different to other healthcare professionals, and can I articulate that? And as I say, just really examine your kind of motivations going forward, because that will help you in the application process, as well as being, really important for you to think about before you commit to doing this really, long course at university. Okay, wonderful. Thanks so much for your contributions. We're now going to move on, slightly similar subject. So what are the challenges involved in studying and practicing medicine? And again, it's really important to have thought about these before you, commit to applying for a 5 or 6 year program. And medical schools will certainly want to know that you've thought about this and that you have a realistic view, as realistic as you can get, view of what it's like studying and practicing medicine. So again, if you could just pop your thoughts in the chat and I will share some. I'll have a quick look. So just thinking a bit about, what might be challenging about studying or practicing medicine. Wonderful. So so Jizzo is saying work-life study balance, definitely. Time management, emotionally overwhelming, yeah, totally. A lot of studying and studying and learning, yeah, when you're at university, long hours, workload, staying committed. What else? Loads of really good bits and pieces coming through here. Emotionally draining, yeah, definitely. Long study years, that's the thing. It's really good to know beforehand that actually, of course, the medical degree is 5 or 6 years depending on where you study, but after that there's lots of further study. And if you think about, obviously you don't need to think about now, but it's having an awareness when you choose a specialism later on after medical school. In the UK you have 2 junior doctor years, and then you decide where you want to, what training pathway you want to go down, and after that you can have quite a long time till you get up to consultant level, depending on what specialism you choose. And in that time, you've got to take exams, you've still got to study, and really annoyingly, you've got to pay for your exams and training yourself when you're working. So actually, if your ultimate goal is to get to consultant level, there is a heck of a lot of training after the foundation years as well. Juggling personal and work-life balance, time issues, a lot of content to learn, yeah, definitely. So thinking about, well, how am I actually going to learn all that content? You've got to devote a lot of time. So that's great. Thanks so much. I think you guys have definitely got a great understanding of the key challenges and things that you need to think about when you're considering, do you definitely want to study and practice medicine? If I could ask our ambassadors to come back on and just talk about what they think of the challenges, but I think they'll chime in quite a lot with what you guys have said already. Can I ask Lima to start?
Yeah, so I think you guys have mentioned most of the main challenges involved with studying medicine, working as a doctor as well. You guys have touched on it already, but there are quite long hours sometimes involved, especially compared to your peers maybe studying different subjects. You have more contact hours, and that is because as doctors we need quite a few skills, and it makes sure that you're prepared once you do graduate. But it means sometimes you do have to say no to a few plans, which can be quite difficult. Sometimes the volume of content or skills that you need to learn can be quite overwhelming, which is why organisation is quite key, and knowing your learning style as well. And on top of that, sometimes I think some of you mentioned as well, medicine can be quite stressful, not only because you have quite a lot to learn, and that can be quite stressful, but the emotional situations that you're sometimes exposed to. So it's quite important that you have extracurriculars or other coping mechanisms or a support network in place that when these stresses do come along, that you can manage them quite well.
So I think a lot of you picked up my sort of main challenge with studying medicine. For me, it's definitely the workload. I'd expect to be in university sort of 9 to 5, Monday to Friday, and giving up sort of a day of your weekend to study, and you need to be quite prepared for that. And I think, echoing what Lima just said, this is different to your friends probably on other courses. And you need to think about ways that you're going to be able to manage that and cope with that, specifically joining societies or doing other things that you enjoy as well as medicine.
Great, thank you. I just want to pull out a couple of key things that attendees have said. So Lucy and Emma have kind of mentioned the fact that it'd be really hard to deal with not being able to save someone, which, yeah, it would be really hard. And I think having an awareness of what will be difficult, even if now you're at a point where you think, well, actually, I don't know how I would do that, I'm not sure how I would cope, but at least having an awareness of what the difficulties would be. Emma said, coping with death, sad conversations with patients and family. And medical schools will focus on things like clinical communication and stuff like that, and they will give you those tools. But as I mentioned earlier, having an awareness of what these challenges will be is really key, because again, it's something that medical schools might ask you about to interview, because we want to know that you're aware of what the difficulties would be. And it might be worth thinking at this point for some of these points, well, actually, you know, how would you cope with that? Again, it could be asked at interview. So as Lima said about, you know, thinking about your support networks, how would you cope with, you know, long days and stress and having to feeling that, you know, emotionally drained? Do you have other outlets that you can use? Are you into sports or anything like that? And how would you, what mental health, you know, coping mechanisms would you have? And again, it's not a bad thing to think about that, because again, it might be worth, you might be sharing in your medical school interviews, basically. Great. So I'm really pleased you've had some great ideas there and thoughts around this. We are going to move on now to some thinking about the application process particularly, but I think it's really important that we've kind of explored these key things that are so key when you're thinking about why you want to do medicine, and, you know, is it something for you, basically, which is really what this whole bit is about. Okay, so moving on. Okay, we're going to focus on the application process and pathway now at this point. This slide is all basically designed to give you an overview of all the different bits and pieces you need to think about, which I'm sure lots of you are already aware of when you're thinking about applying for medicine. So there's things like work experience and alternatives, aptitude tests or admissions tests, which you might need to take in the year of application for some medical schools. You've got that early UCAS deadline as well of the 15th of October. Pretty much all medical schools interview, and that normally happens November to March, depending on the uni. After that, hopefully you'll get an offer. And thinking about your UCAS application, you've got to think about academic entry criteria and your personal statement, and the academic reference will also come in there as well. So there's an awful lot to think about and quite a lot to get your head around this year. But what we'd really like to do in this presentation is, I guess, just talk briefly about, you know, most of these elements. And I think bearing in mind that while the whole picture can look fairly overwhelming, if you break things down into smaller chunks and have an understanding of, okay, at this point of the year I need to focus on this and I'll worry about this thing later, that can just help to break up that whole complex process and make it easier. But having said that, there's lots of different dates and deadlines involved here, so I'd also really advise thinking about getting key dates and deadlines in your diary and just doing research at this point so you know what you have to do at certain points of the year. Okay. So I'm going to talk a little bit about academic entry requirements first of all, and this is, I guess, the first hurdle for a lot of applicants. I'm going to be talking a bit about, I guess, in reference to kind of school leavers here, so people who are maybe doing A-levels, IB or equivalents and are applying to those kind of school leaver medicine courses. So, you know, academic entry requirements are different for different medical schools. So again, it's about doing your research beforehand and knowing where you're going to be eligible to apply. So while chemistry and biology are usually important, you know, sometimes universities are maybe more keen on chemistry. You know, different unis have different emphases. So some universities will say you need to have maths as an A-level as well, and some won't. GCSEs can be important as well. So for some universities like St George's, we say that you have to meet our GCSE and our A-level requirements. Okay, so if you don't meet the GCSE requirements, you wouldn't be considered. But for other unis, they might say actually GCSEs are not so important. So if you've got really good A-levels, that can make up for it. It's really important to only apply for courses where you're likely to meet the academic requirements. When you apply through UCAS, you have 5 choices, but only 4 of them can be for medical schools. So it's really important that you're strategic in terms of where you're applying, and you're applying to places that you're most likely to be considered. I've included the St George's entry requirements here just to give you an indication. So we are looking for 3 A's at A-level, and that needs to include chemistry and biology. But in terms of the subjects, we have no preferences. If people get higher grades than what we're asking for, they're not given a preference over other people. So if you get all A stars, you're not treated any differently to someone who's predicted all A's. Our GCSE requirements are 5 GCSEs graded B6 or above, and that needs to include English language, maths and science. Okay, and again, if you get all, you know, A stars or 9s at GCSEs, it doesn't mean you're treated any differently in our application process, but for other universities it might be different. So again, it is quite complex, but just requires doing a lot of research and, you know, phoning universities, checking on their websites to see exactly how their admissions process works. At the bottom of the slide, you can see, excuse me, we've got an example of St George's contextual offer. So at St George's, eligible applicants can receive a lower offer than our standard conditional offer. So, and this relates largely to postcode measures. So if you live in particular postcodes where less people go to university, you may be eligible for a contextual offer. Lots of other universities have similar schemes, but they might look at different things. So it might be that if you're on receipt of free school meals, or if your parents haven't gone to university, then you may be, you know, eligible for other things at different universities. And again, it is difficult, I suppose, to look at because each university will have its own way of operating. But it's always good to research these things if you know that you are in, you know, a disadvantaged group or a group that's underrepresented at university, because you may be eligible for a slightly different offer at some universities. Okay. A little bit about admissions tests for medicine. So lots of medical schools will particularly ask for the UCAT exam, and a small handful ask for the BMAT. So for both of these tests, I'm sure lots of you are already aware of this, but just to give an overview, for both these tests, you must take the test in the year of application. So that would be this year if you're applying for 2022 entry. Now the tests are slightly different. So for the UCAT, there's no specific kind of science content or knowledge that they're wanting you to demonstrate. It's all about showing how you think about things, your logic, and your approach. So while you can't revise for the test, you can prepare for it. Yeah, and with the BMAT, that test has 3 sections, and one of them is a science paper. Okay, so for that you do need to show that knowledge. For both tests, unfortunately, you do have to pay test fees, but if you're in a group that you know, is underrepresented at uni, if you're eligible for free school meals potentially or get a bursary, you may be eligible for to not have to pay those test fees. So again, I'd really advise you to go on the 2 test websites and just check the eligibility criteria, so that you know, hopefully you wouldn't have to pay that money. For both of the tests, preparation is obviously really important, and you can get practice questions and preparation materials online. Again, you have to register in advance to take both of these tests, so it's really important to look into this now so that you don't miss the registration deadlines, because obviously you have to register and then book your test, but you have to do one before the other. So what you don't want to do is wait till, for example, August and then realise that you can't book the UCAT. Okay. So again, just really worth kind of looking into the test, and I would say the test websites are the first port of call. Now, I did want to, I'm going to try and run a poll now, just to get a sense of you, the audience, and you know, where you kind of are with admissions tests, and you know, if you're at the point where you're practicing papers and stuff for them or not. So I'm going to try and launch this poll. What should happen is that the question should come up on your screen and you should be able to answer the question. I'm really hoping you can see that. Yeah, great, some of you are responding. If you can't respond to the poll, what you can try and do if you have the webinar in full screen mode is try and minimize it a bit. Great, so the question is, have you looked at or taken any practice questions for admissions tests yet? Okay, I can see lots of people responding. Thank you for just keep on responding, and I'll close that poll in a minute and share the results with you all. Great. Okay, thank you. Let's give a minute or 2 more for people to respond there. Okay, I think 82% of you voted. So I might just leave it a tiny bit longer and then close it just so we can move on, and I'll try and share those results with you. Okay, we're at 85% now, so I might close it because I don't want to dwell on this too long. Okay. I think you should be able to see the results there. So let's see, so 46% of people have looked at examples but haven't done any kind of practice questions themselves. 33% of you have done some practice questions papers, and 22% of you haven't. So that's great. I think what's really positive is that lots of you have looked at examples or have done some practice questions, and as the time gets, you know, nearer, depending on when your test date is, if you are going to take the UCAT or the BMAT or both, I would really encourage you to you know, do those practice questions, because actually that's the best way to get a feel for it, and especially for the UCAT, which I'm slightly more familiar with because it's a test we ask for at George's. Part of the kind of the preparation for the UCAT is just getting used to answering loads of questions in a short amount of time, because it may not be that you're able to answer all the questions, but you know what they're testing you on is your ability to prioritize and to decide what questions to spend lots of time on and which ones to not bother with. Okay, so actually for UKCAT especially, the more you practice the questions, the more you get used to the format, you know, the hopefully more comfortable you will be on the test day and the better you will do, because actually feeling comfortable with the test and knowing what to expect can be half the battle psychologically when preparing for these things. So that's great. Thanks so much for doing that, poll. And again, I'd really encourage those of you who've looked at examples to start thinking about those practice, and also for those of you who haven't, just to start looking into those type of things now. Wonderful. Okay, hopefully you can see my slides again now. Wonderful, and we'll move on. Okay, so personal statements. So with personal statements, you need to do one, obviously. So wherever you're applying, it's something that you do in your UCAS form. Really important to just know that not all unis will use personal statements in different ways. So some will look at them and they might, you know, place quite a lot of weight on them when they're deciding who to interview. Others might not look at them so much. At St. George's, we don't assess the personal statement prior to interview, so it's not something we take into account when we're inviting people for interview. It's just good to know that, I think. And again, different universities will use them in different ways. In terms of what they're for, I suppose they're really about getting across your understanding and your passion, your motivation. Why do you want to do the particular course that you want to do? You might want to talk about stuff like work experience, if you have any in there. And it's really about showing that you're the right candidate for the course. Why are you well suited to the programme that you've applied for? Okay. Really important that it's in your own words. Okay, it's good to start, you know, doing a few drafts and getting other people to look at it, definitely, but you know, it does need to come from you and yourself. Okay, there is lots of information on the UCAS website about personal statements, but it's a difficult thing, because what you really want to do is you need to kind of get across lots of different things, but it needs to be in quite, you know, you don't have much room to say it. Basically, there is a kind of word limit for your personal statement, but what I'd really say is that you need to make sure every sentence counts. You know, everything has a point. Don't talk about books and things like that you've read if you're just literally saying, I've read this book, I've done this. You need to be making it count by saying, you know, I've read this book and it taught me this. Okay, so everything is kind of, you know, got a meaning, it has a purpose in your personal statement, if that makes sense. Okay, let's keep going. Okay, I'm going to talk a little bit about work experience. So lots of medical schools usually ask for, you know, work experience as a prerequisite, and that in the past has included things like, you know, volunteering, doing shadowing, maybe working at a care home, working with people in need of care, basically. But you know, medical schools are very much aware that, you know, this year and last year, candidates didn't really have the opportunity to get face-to-face work experience. So last year and for this year, you know, lots of universities may have changed what they're asking for, basically. And on screen you can see the St. George's requirements for this year. So we have chosen to relax our work experience requirements for you know, courses which would normally require these, so healthcare courses. But despite those relaxed requirements, we still require our applicants to have an understanding of the realities of working as a healthcare professional and to show they have the necessary skills and attributes for their chosen career. It's really important to say that these are things you can still do without getting face-to-face work experience. Okay, I'm not going to talk any more about work experience because we are doing a work experience for healthcare courses and medicine webinar in a couple of weeks, so I really encourage you to sign up for that. We're going to be talking about, you know, what types of things you can do and how you get the most out of your work experience, and also what you can do, you know, when there's a pandemic on, you know, what alternative sources or resources can you use when you can't get work experience. So not going to talk about it now, but I really encourage you to come along to that, where you'll get lots of kind of good advice and tips. Okay, really quickly, I've talked throughout the last few slides about how, you know, it is different at different universities, medical schools, how they assess people and apply. So this is just to give you an example of how it works at St. George's and for our medicine courses. So at St. George's, if you meet our academic criteria for the course, so that could be A-levels and GCSEs, and you meet our requirements for the admissions test that we're asking for. So for our A100 course, that is the UK CAT, SCAMSAT for our graduate entry course. If you meet what we're looking for in both of those aspects, then you get an interview, which is an MMI interview. Okay, like I mentioned before, we don't look at personal statement prior to interview. So at George's is very cut and dry. The UCAT or GAMSAT, kind of what we require each year might change slightly, but basically, if you get an interview, it's because you've met those criteria, and if you don't get an interview, it's because you didn't meet both of those criteria. Okay. Other universities might have a different approach, so they might look at everything together, take a holistic approach. So they might look at your personal statement, but also your grades and your admissions test scores, but they might not actually have like a cutoff point for the UCAT or BMAT. So it just depends on the university, but this is just to give an example of what we do at George's. Okay, let's move on. Now, this is a really long way off, so I'm not going to talk in great detail about this. Just a bit about interviews. So I mentioned earlier that pretty much all medical schools interview, they can happen from November onto March in year 13, if you're in year 12. There's different types of interviews. So some universities run panel interviews, where the same people ask you a few questions, you answer back. Lots of universities increasingly are doing multi-mini interviews or MMIs. And you can see a picture here on the left of the MMI setup at St. George's if you have a face-to-face one. These are very different. So it's a series of mini interviews, as the name suggests, where you're interviewed by 7 or 8 different people and their scores contribute to your overall interview score. So it's a different way of doing things. Lots of universities last year ran remote interviews. So at George's we did interviews still. We asked applicants to send us recordings of them answering interview questions. Other medical schools will have done Zoom interviews, so like panel interviews but over Zoom. So it's just worth bearing in mind that it might be that if you're applying for 2022 entry, you may still have a remote interview. I think lots of universities at the moment, certainly at George's, where we haven't decided on what we're doing yet, if we're able to do face-to-face or remote interviews. So it's still unknown at this stage, and I imagine it probably is at other universities, but it's just good to have an awareness that it may be a remote interview that you're asked to do this year. And those are quite different to face-to-face ones. But again, you don't need to worry about that now. It's just good to kind of know at this point. Okay, a lot of talking from me. So again, I'm going to ask for your contributions now. We're going to have a talk about skills required in healthcare and medicine in particular. So I'd really like to get your thoughts on what skills do you think are important for doctors to have? And linked to that, what kind of skills do you think medical schools might be looking for? So if you could just pop your ideas in the chat and I'll read some out. And again, it's important to note that medical schools aren't looking for fully fledged, people who can just, who are already doctors or very capable, because actually the medical schools are looking for potential. We teach you lots of stuff, but we need a foundation to build on. So we're looking for people that show potential in terms of the skills they have. Okay, things like transferable skills, what do you think are important? Okay, let's have a look and see if anyone has any suggestions. Okay. Fantastic. So many responses. Thank you all so much. Empathy, confidence, patience, resilience, really key. Resilience coming up a lot. We've kind of talked about resilience when we were talking about the challenges a bit. Good communication skills, time management, adaptability, determination, passion, definitely. You've got to be very committed. We've talked about the long workload and the long years of study, so really important that you're passionate about what you're doing. Good listening skills. It's really important to think about when you're thinking about communication skills. It's not just about being able to talk well, but listen well is really important as well. Really like this answer from, is it Zainab? Recognizing your limitations. Zaina, sorry, that's so good, because certainly what medical schools want, we don't want people to come to us and say, I'm great at everything, I'm good at this, there's nothing else I need to do. Everyone has things they need to work on, and if you have a doctor that doesn't think they have anything to work on, then you're probably looking at someone who's a bit dangerous in practice. So having a sense of what you need to work on in the future is really important. Integrity, great. Multicultural skills, definitely. Yeah, being able to make a decision, says Theresa. Amazing. Fantastic. So many good ideas. Skills in clinical communication, yep. So we've already talked about, how the fact that, this is something that you do at medical school as well. You have, certainly at George's, and there's quite a lot of focus on clinical communication skills that our students do. Fantastic. I'm going to ask our ambassadors to come on and just see if they've got anything else to add, but I think you guys have covered it pretty comprehensively, to be honest. So.
So I think lots of different skills were mentioned, and you covered, I think, most of them actually. I mean, just highlighting some of them, I think teamwork was mentioned, and I think it's important to have an awareness of these skills and that they're required in a career in medicine, but you will develop them throughout medical school as well. But there's lots of different ways you can show teamwork, for example, and like Fiona said, showing that you have these transferable skills is quite important too. Maybe a different one, passion for learning and teaching as well. Medical school, I think Fiona mentioned it earlier as well, you're not just learning in medical school, but also after you graduate, you've got exams, trainee exams, consultant exams, and you're constantly learning, but also teaching. So I think that's quite important too.
Yeah, so mirroring what Lima and Fiona have said already, good communication skills and organisation skills and things like that are really, really important. But we get lessons on those the whole way through medical school, and they're something that you can develop over time. I think things like being compassionate and kind and hardworking are things that are more ingrained in your personality, and that's something that's really important.
Great, thank you. I have got some up here that I've just realised actually. I hope I wasn't on that slide the whole time. These are the type of things that St George's is looking for, so from our medical students, and lots of these things are key skills and qualities that you've mentioned already. And I think there's also, if you go on, for example, the Medical Schools Council website, there's lots more information about different skills and qualities. And again, different medical schools might have a focus on particular ones, so they might say this is what we're looking for from our candidates. But yeah, I think you've mentioned loads of them. Things like effective learning style, resilience and initiative. We've definitely spoken about empathy as well, communication skills, teamwork, insight and integrity. And I think it's really good to start like breaking these points down, which I think a lot of you kind of were doing in the chat already. So it's about thinking, well, what is communication skills? What is involved? What skills are involved in good communication? So it might be thinking about, well, actually, what might you consider when explaining a diagnosis to a patient and their family? What different things would you have to kind of think about? You might think about, well, who am I talking to? Is it a young kid? Is it an older person? Do they speak English? Thinking about explaining, technical medical jargon, that type of thing might be important. Insight and integrity, thinking about, well, how might you encourage a reluctant patient to undertake an examination? And lots of these things are linked together. So for this one, it's about having insight into possibly their worries and what their concerns might be, but it's also about empathy as well, because you're thinking about, well, what can I anticipate? What might they need from me to do this thing? And again, teamwork, so thinking about working as a multidisciplinary team, what skills are needed, and things like communication skills, delegation, all kind of needed in that, basically. So like I say, it's about breaking down these points and certainly thinking about, what skills can I showcase to the universities, and how can I give examples in interview, for example, to show universities that I have these key skills that they can build on. Okay, so at this point, I'm going to stop talking and I'm going to hand over to Billy and Lima just to talk a bit more about their experiences and to give you some of their tips. So I'll hand over to you both now.
Okay, just to introduce myself a bit more. So I'm Billy and I'm a final year. I was on the graduate programme. So I've just qualified now and I'm originally from Essex.
So like I mentioned, my name's Lima. I'm a third year medical student. I'm coming to the end of my third year. I'm from the undergraduate programme and I'm from London.
So first of all, I think we were going to talk what we considered when we were choosing which medical courses to apply to. I think for me, I really researched into whether it was a PBL based or a lecture based degree. I think it's important as well to know, which I didn't really understand, that even though it's PBL based, most places and universities still do lectures along with that as well. So it's not just completely PBL, there is a mixed approach. We also have clinical skills and communication skills teaching in with that as well. Another thing that I thought about when I was applying is at what year I was able to start seeing patients, because that was really important to me to start seeing them early on. I know here we see them from our first year, as well as our clinical years, which are the last 3 years of the degree. Some places can do it later on than that, and it's just in the clinical years. So that's something for you to consider when you're looking for places to apply.
So when I was applying to university and looking at the different medical schools, one of the location was quite important to me. I'm from London and I wanted to stay quite close by, in London, or at least quite close to London. So that was important to me, and I think that is something important to consider because you are spending 5 or 6 years here. So you do want to make sure it's a place that you want to be living for quite a significant portion of your life. And I also considered the kind of teaching style of the university. For me, early clinical contact was also quite important. And I think at George's, because we do share a campus with the hospital, you're kind of immersed in that clinical environment from very early on, and you get those placements as well in your first year. So I really enjoy that. Similarly to Billy, I also enjoy a PBL, a problem-based or case-based learning style. That's something that I quite enjoy, and it allows me to ask questions and really understand the concepts, and that's something I found quite suited me. I think also I attended a few open days, and I also attended a taste day at St George's, and I really liked the environment. So I think that's also something important to do, making sure you visit the university if you can, COVID allowing, and have a look around and see and speak to the students. And I really enjoyed visiting St George's, so that's something else. And I also another reason I really like St George's is the diverse population you get here, patient population you get here. So you're exposed to quite a few different conditions, and then I thought that was something that's quite important to me as well.
Something I forgot to mention as well that I didn't really think about until I started medical school was sort of the extracurricular stuff. So like the societies and the social events that the university offers, because one of the fun things about doing medicine is the social side of things. You spend a lot of time with your peers and get very close to them. You spend a lot of time together, and societies and clubs can be quite a welcome break from studying. So now we were going to move on to just some tips on preparing your applications as well. Do you want to start with that, Lima?
Yeah, so in terms of tips I mentioned going to open days and taste days or virtual events like these. And if you can speak to some current students at the university, they can usually give you quite a good insight in how studying medicine is there, and also might be able to give you some tips specifically about applying to that specific university. I also think it's quite important that if you can get as much work experience as possible, and remember any sort of experience is useful. So volunteering experience, charity shops, care homes, they're all valuable. And when you do these, it's really important to document your experiences, and that's quite useful when you come to writing your personal statement or preparing for your interviews, so you can reflect on those experiences. Remember to not write down any patient identifiable information, but yeah, try and keep a note of what you're doing and what you see.
Yes, so I think my main one will be to prep for your entrance exams as early as you possibly can, and try and practice so that you've got like the BMAT and the UKCAT are the main ones. Try and practice both and see which ones that you're better at, and then try and apply for the medical schools where you're better at that entrance exam, because there's no point in wasting any of your 4 choices, because there's only 4. And another thing is to really think hard about whether this is what you want to do, because it's a very rewarding career and medical school is really fun, but it's also quite tough. So if you're only half invested in it, it's really difficult to succeed.
And I think just to add on to that as well, I wanted to mention that, there's lots of components to a medical school application compared to a normal university application. You've got your entrance exams, your personal statement, your interviews. So I think it's quite useful to write down all the components that you need to complete, or have a look at the entry criteria and then create a timeline. So you're on top of all these different components of the application, and so you can take it one step at a time, because it can be quite stressful.
That's it. Thank you. We'll hand back to Fiona.
Great, thank you. So I had included some top tips, but I think we've covered lots of these already, and definitely Liam and Billy have talked about them as well. So about just being really kind of organised and on top of entry requirements and thinking about what you're applying for, doing a timeline like Liam suggested. And think, hopefully the students have given you some ideas in terms of choosing universities and courses and what they took into account. And like Lima said, getting to know university and whether it's right for you is really important. And universities would love to have people on campus to come, and see them and see what they're all about. Certainly we would at George's, but unfortunately it's something that we, lots of places, including George's, we just can't do at the moment. But we are doing lots of virtual events, and medical students in particular, if you want to do medicine, are such a great resource. If you want to ask questions and find out what a course is really like, because you'll often get, I guess, the full picture of what's good and bad about an institution from speaking to current students. Prospectuses and websites want to tell you how great they are, but everyone has bad points. So it's good to kind of get the inside tip really from medical students. And attending events like these is good, but also lots of universities, including George's, have something called UniBuddy. So if you go on our website, a little chat box pops up and you can ask current student questions. And so I'd really encourage you all to try and speak to those students at different unis, and just to get an idea of how it works at different unis and what might suit you best, taking into account grades and things, of course, but also all those other factors you need to take into account when you're choosing a uni. And again, maybe think a bit more about, key skills and qualities for medicine, and thinking about, well, how can you prove to universities that you have those? Maybe start documenting things. Definitely for interviews, although it's so far off, as I mentioned earlier, you need to kind of give evidence. It's as someone who interviews the medicine course, if someone comes along to an interview and says, I'm great at empathizing, I'm great at communicating, but they don't give any kind of evidence or examples of that, it's not very useful. So it's reflecting on what you've already done is really useful to start doing now, so you can kind of start thinking about that as you go forward over the next few months. Okay, we're nearly at the end, but we do have time for some questions, and I know loads of questions have come in. So I'm going to ask my colleague Jenny to come on screen and just share any questions that she might have for staff or students, so we can answer some of them before we finish up today.
Hi everyone, great questions coming in today. The first one is, what are the benefits of early access to patients?
Hi, so I think the main benefit really is developing your communication skills. The quicker you can start seeing patients, the quicker you get used to talking to them, and the better that you are at it. Also, I find when you see a condition on a patient, you're far more likely to remember that condition later on, remember the patient, what symptoms they had, what investigations they had, what management they had, because you kind of attach it to a person. You're not just reading it out of a textbook or a lecture. So I think that's the main benefit for me anyway, seeing them early.
Yeah, and just to add on to that, I completely agree, but it's also quite motivating, and seeing, the environment that you will be working in, constantly doing lectures, I find can sometimes be quite demoralizing. So having that, clinical exposure, I find quite nice.
Great, thank you guys. We've got Jess asked, how do you make yourself stand out as a medicine applicant?
I think to answer that one, it's quite difficult. I think sometimes we've all got work experience and volunteering experience, but your extracurriculars are also quite important, I think, and they demonstrate lots of transferable skills too. So I think that's one way you could make yourself stand out on an application.
I think it's difficult at the early stages because, you know, everybody's getting the good grades. Everyone has to get a certain score on the entrance exam. I think it's more in the interviews where you can really put yourself across and really start to stand out. I think it's about coping well under pressure. So I've done a few MMI interviews, and I can see somebody's really nervous, and that's fine, but it's how they get through that answer and still get something across even though they're nervous. So don't get disheartened if you feel like you sounded really nervous. It's the content of what you're saying. As long as you've got that across, then that's what people are really looking for.
Yeah, and just to add on that, I think it is hard to, it's annoying. There's not always like one right answer. There's not one key thing that will help you stand out as a medical applicant, unfortunately, because it really depends on different medical schools and how they assess. And, you know, I would agree with Billy that, you know, the interview can be really, really important. And again, it can depend on the interview format. So for MMIs, you're often assessed by, say, 7 or 8 different interviewers. So you can't really make much of a key impact. What you need to do probably to be successful in that interview is to be consistent and to get good scores in every station. But certainly in terms of prepping for interview, I think it's a psychological barrier, and feeling comfortable and, you know, comfortable enough to talk and to kind of get your true self across in those kind of interviews is the best tip. So it's annoying there's not really like one key thing you can do. And obviously if we told you, everyone would get in. So it's one of those things, it's a boring answer, but I think just being consistent, definitely in terms of the interview is good as well.
Great. Ali's asked, are the modules more course-based or exam-based?
I'm not sure what you mean. Do you mean coursework based in assessments or exam based?
I think that's what she's meaning.
Okay, yeah, so it's pretty much all exam based. So you have, depending on the year, but most years it's a set of summer exams every year. So you have a written exam, which is like a knowledge test, and then you have something that is called an OSCE, which is a practical exam as well. So it's usually those two components. There's some essays, yes.
Yeah. I think, yeah, Billy was about to say you do have some SCT, so student selective components, where you get the opportunity to perhaps, you know, explore an area more in detail that you're quite interested in, and they're also assessed.
Great. Philip has asked, where do the clinical placements take place?
So I think in your earlier years, they're usually based around George's or quite close by, but in your, you know, later clinical years, you can be sent out around Southwest, you know, Southwest England and Southwest London, really. So you can be placed in different places, but if you do have particular circumstances or special circumstances, you can request to stay at George's.
If it's a good distance from George's as well, so if it's quite far to get to, we get accommodation, so you stay there, so you don't have to do sort of a 2-hour journey or something every day.
Great. Alex has asked, are medical students able to apply to more than one speciality during residency? If so, is it recommended?
Is this something that you know a bit about, Billy, as a final year, or?
During residency, is it, do you mean for the foundation training programs or? Okay, so usually we apply for a foundation training program, and you rotate around 4 jobs every year, and those jobs usually include a medicine job, a surgery job, and sort of an acute medicine job, so A&E or something like that, and a community job, so like general practice or psychiatry. You do get to choose what rotations that you go on. In terms of like certain specialties, there's an academic foundation program, that you can apply to. So if you were into clinical teaching or research, but generally for the first 2 years, so your foundation year 1 and your foundation year 2, you'll be rotating around jobs. You couldn't really pick a job just to stay on. I hope that answers the question.
Great, thank you so much. And Raki's asked, could you please explain how the dissection works?
So the dissection, we do prosections. So it means that the cadavers are already dissected for us, and we go in and the demonstrators use those dissections and they demonstrate the different anatomy. In your preclinical years, you do that once a week. And anatomy sessions usually relating to the anatomy that's discussed in your tutorials. So yeah, you do get some opportunities if you'd like to do a summer dissect. There is a summer dissection program which you can apply for, where you can go and dissect cadavers if that's something you're interested in.
Fantastic. Amani is asking, do you have to do both UCAT and BMAT?
So for St George's, we ask for the UCAT. Other universities will ask for BMAT, and I think it's up to you really. And I think Billy mentioned before, what you could do. I think it depends on the universities you want to apply for. So if you've got an idea of the unis you want to apply for, and you're like, okay, you'll know for them if they say you need to take UCAT or BMAT. If you want to hedge your bets a bit, if you're still undecided, as Billy mentioned, I think you could do both and then see how you do. And then, for instance, if you do well in the UCAT, you could think, okay, well, I'm going to apply to UCAT unis. And if you don't do well in the UCAT, then you'll go, okay, I won't apply to UCAT uni. So it is about looking at the timelines as well of when you would have to register to take those tests and when you want to be making decisions on, what universities to apply to, I think. I don't know if anyone else wants to add to that. Cool.
Great. Thomas asks, can you take all 3 sciences at A level?
Yeah, definitely. So I think the 2 subjects required at George's are biology and chemistry, and the 3rd subject can be anything really. I think there's general studies, but Fiona could probably clarify that for me, which is not accepted.
Yeah, so for St George's, you can take 3 sciences if you want, but we don't ask for it. So if someone's asking about entry to St George's, we would advise, well, your 3rd subject, as long as it's not, general studies or key skills, can be anything. And if we would advise people, I suppose, that it's always good to continue with a subject that you enjoy doing and that you're more likely to get good marks in, I suppose, for that 3rd subject. But again, it can depend on the other universities that you're applying to. And as I mentioned earlier, some universities might have preferences for what that 3rd subject is. It could be science, it could be maths. So again, it's just important that you do your research at different universities to make sure that you're meeting the requirements of the unis you want to apply for.
Great, thank you. And we've got, Beck has a question about class sizes. So what are the class sizes? I'm assuming she means around lectures, CBL, PBL, and such.
So so it depends what year you're in at St George's, depends on the class size. So I did a graduate entrance program, so that was quite a small year group, so that's only 50. But correct me if I'm wrong, Lima, there's a lot more in the undergrad. Is there like 200 or something?
Yeah, so it's around 200.
And then what happens in T year, which is our 2nd year, is we all merge together. So the undergraduates, the graduates, and then the transfer students all merge together in 1 year. So then that becomes quite a large year. There's about 300 of us in the year. But PBL groups are quite small, so there'll be about 10 of us in a PBL group. And skills groups will be quite, so you get broken down into groups of 4 for those. So they're smaller groups.
Thanks for that. That's great. And I think we've got time for one final question. Is that okay, Fiona? We've got Toby is asking about intercalating. He's saying, is there an option to intercalate? Yes, there is. And is it worth doing an intercalation?
So there is an option to intercalate at St George's. Whether it's worth it or not, I guess depends on what you want to get out of an intercalation. So some people take out an intercalation year, to get a break from medicine, but also some people, use the time to, build up their research skills, do some research. Perhaps, if they get the opportunity to go to a different university, or focus in on a specific specialty. So, whether it's worth it or not, it really depends on what you want to gain out of it, really.
Thanks. Back to you, Fiona.
Great, thanks, Jenny. So we know there's a lot more questions, so we will get back to you after the event. What we'll do is we'll send you an email response to your questions after the event. So thanks very much for all those. So just a couple of bits to wrap up before we head off. So if you do have any questions for us, you can get in touch via webinars or study@sgul.ac.uk. Like I mentioned earlier, you can also speak to our current students via UniBuddy as well if you go on our website. A few last minute bits and pieces. So this webinar is part of a series of events, and you can see the other titles and dates listed here. So we're going to be running one on exploring healthcare courses and careers. So if you're thinking about, I'm not sure medicine's for me, but I definitely want to work in healthcare, please do come along to that event. Just need to come along to our website and register. And same with the work experience for healthcare courses event as well. That will include medicine. So if you want to find out a bit more about work experience and how you can demonstrate to medical schools that you have that insight about, what it's like studying medicine, do come along to that event. We're also going to be running I guess an open day replacement event in a few weeks' time. So on the 16th of June, we're going to be running a introduction to medicine at St George's event. Now that is going to be very much more about the medicine course at George's and how that works. So please do have a look on the website. All of our webinars are in one place on our website. If you Google or go to that address, you'll find it. And do sign up for that webinar as well, because you can find a lot more about what medicine is actually like at St George's. I think that's almost all from us. We will be sending you out a kind of poll, and one will pop up after if you can just let us know how you found today's event. We will also be sending out this recording to you after, so you can come back and have a look at any points you've missed. I don't think there's anything else we need to say, but thanks so much for coming today. We really hope you found this event useful, and we really hope that we'll see you at another event soon. Yeah, it's goodbye from me and goodbye from Jenny and our ambassadors as well. Cool. So take care, everyone. Bye bye for now.